Hi, nurse practitioner and functional nutrition coach Nicole here. I wanted to talk to you guys about thyroid lab testing. Now, as always, these videos are for information purposes only, not meant to diagnose or treat anyone. You need to follow up with your primary care. If you're only getting your TSH level checked, you might be missing some key information. Especially if you find you're still having symptoms despite a normal thyroid TSH level, such as fatigue, thinning hair, prolonged sleep that's not restful, suppressed appetite, weight gain, constipation, slow stomach emptying, impaired exercise recovery, fatigue, brain fog. Getting just a TSH check is probably not sufficient. To start, we also need to take a look at some other markers of thyroid health, such as your T4, your free T4, which is a precursor to T3 and free T3. Those ones are your active forms. The free T3 especially is your active form of thyroid hormone that actually works on the cells. If we're not getting to the T3 stage, you're still going to have symptoms of low thyroid functioning. I also want to take a look at an antibody called TPO-AB antibody. Now, this can act against the thyroid tissue and create autoimmune disorder, most commonly Hashimoto's. Graves' disease is the hyperthyroidism form of an autoimmune disorder as well. One of the most common medications for hypothyroidism is levothyroxine, which works well for most people. However, it's only T4. So if you're having any problems converting that T4 into the active T3, or if you have an infection or inflammation in the body that's causing what's called a reverse T3 to form, which looks very similar and will actually act on the same receptors as free T3, however, is not bioidentical and will not cause any effect as the active free T3 would. So if you're having any of these problems, notice that your TSH is normal, you've been on your levothyroxine for, however many years, you get your 6-month checkup and they're like, yeah, everything looks great, you still feel like garbage, dig deeper. Be your own advocate. Educate yourself about your diagnosis and do not settle for feeling like garbage as your baseline.